Hello, everyone, and welcome to tonight's Omaha Table Talk. My name is Dominic Greene. I use he, him, his pronouns, and I serve as the Director of Programs and Faculty at Inclusive Communities. Before we start tonight, I would like to acknowledge the traditional homelands of the Native and Indigenous people who lived and took care of the land that most of us gather on tonight, that belong to the Omaha, Ponca, Pawnee, Oda, Missouri, Sante Dakota Sioux, Kansas, Iowa, Cheyenne, and Winnebago people. We honor with gratitude and pay our respects to all Native and Indigenous people. Omaha Table Talks, or as we refer to them as OTTs, was initially recreated in Omaha in 2003 by the Social Justice Advisory Committee of Catholic Charities Omaha. And in 2012, Inclusive Communities acquired OTTs and shifted them to a larger public format discussion over comfort food. And so due to COVID, we have shifted them into being on Zoom, but I'm happy to let you all know that we are actively working on coming back and offering them as an in-person hybrid model starting in July. So just be looking out for that information. While during tonight's conversation, though, I do invite you to have comfort food or some snack or beverage with you to have while we have tonight's conversation. We are also always looking for ways that we can grow and get better at this event. So at the end of tonight's conversation, there will be a link or a QRX code for you to fill out our feedback evaluation, and we welcome all the feedback that you would like to provide. I want to take this time to acknowledge and thank our sponsors, Lozier Foundation, Cox Communications, and American Family Insurance for making our events, our Table Talk series possible. And I also would like to just cover a couple of short housekeeping logistics. We are recording tonight's conversation. We record just the panel conversation and then the share outs at the end. We do not record the breakout rooms where we all go into our small groups, those conversations. That recording will be shared on YouTube for folks who were not able to attend tonight's conversation to watch later. So if you are uncomfortable with your image being shown on that video recording, please just mute your camera and that your image won't be shown. I would like to also acknowledge all of our volunteer facilitators, and they all have facilitator next to the name, and thank you all for being here and helping us out. Also, if you are someone who is in need, who would like to use or need to use our ASL interpreter, just message Colin in the chat link, and he will make sure that you are in a room with Jamie or any of our Spanish language interpreters, and he will make sure that they are in that same breakout room with you. We also have our closed caption feature on as well. Our timeline tonight, sorry, I don't usually do this part, so I'm stumbling over some of my words. Our timeline tonight, we will have our panelists introduce a topic, and then we'll go into our breakout rooms or small group rooms and talk and have our own discussions, and then come out and do some share outs, and if we have some time, Q&As with the panelists. And at that, I think I've covered everything I need to. So I'm going to introduce our moderator for tonight's panel conversation, Nikki Smith, and she will take it away.
Hello. Thank you all for being here tonight. I do just want to say before we get started that in light of recent events this week and today, we want this to be a place where everyone feels safe and comfortable. Trauma can be a difficult topic in and of itself. So if at any point you need to take a step away or you just need to go ahead and go, that is absolutely okay. We love seeing all of your faces, but if you are more comfortable having your camera off, also feel free to do that. So for this table talk, we did partner with a organization called Omaha Social Impact Ecosystem. They showed the film The Wisdom of Trauma this past Wednesday. And so this table talk tonight is kind of a continuation from the conversation that was started in that film. That being said, it is absolutely okay if you did not see that film. You will not be missing out on anything in this conversation tonight. But I did ask Kara Cavill, who's a member of that group, if she could give us like a 30-second elevator speech. 30, well, it could be more than that. About what the film is kind of about, just for the folks who were not able to see that film, and then we'll introduce the panelists after that.
Okay. Thanks, Nikki. Hi, everyone. A 30-second elevator speech. So The Wisdom of Trauma is directed and produced by Maurizio and Zaya Benazzo from Science and Non-Duality, which if you put science and non-duality together, it's SAND. So you can look them up if you're interested. So in The Wisdom of Trauma, best-selling author and physician, Dr. Gabor Mate, who has dedicated his life to understanding the connection between illness, addiction, trauma, and society, explores why Western society is facing the epidemics of anxiety, chronic illness, and substance abuse. Trauma shapes the way we live, the way we love, and how we make sense out of the world. And in the film, Dr. Mate gives us a new vision to inspire a trauma-informed society that seeks instead to understand the sources from which troubling behaviors and diseases spring in the wounded human soul. And he points us to a path, hopefully, of individual and collective healing. Dr. Gabor Mate also has written, as a best-selling author, a great book called In the Realm of Hungry Ghosts, which is referenced in the film. And it's a book that sort of connects our understanding of addiction with childhood trauma. So I would encourage you, if you haven't read it and you're interested in this topic, that's a great resource. Thanks.
Thank you, Kara. I realized I forgot to say even my name. So Dominic introduced me, but I didn't actually say that. I'm Nikki Smith. I work with inclusive communities. My pronouns are she, her. I just finished up my social work degree at Nebraska Wesleyan, and I will be starting actually full-time with inclusive communities here in a couple weeks. But I would love to hear from our panelists. If I could just have our panelists introduce themselves and then give kind of just a brief, like, tell us how you're connected to this topic of mental health, trauma, and resilience. Do we want, let's see here, can I have maybe Charymane start us off? Thanks.
Yeah, good evening, everybody. My name is Charymane Adams, and I'm a faculty member at the University of Nebraska in the counseling department. And I work there as an assistant professor, and I also coordinate our clinical mental health counseling track. So my kind of entire work has always been in crisis and trauma, even before I was a counselor. I worked at inpatient psychiatric hospitals, did some mobile crisis for a little bit, have had the privilege of teaching our crisis and trauma class, and have done a lot of research on how we can teach about trauma without traumatizing students. So it's a wonderful privilege to be here with some colleagues in the community to hear their wisdom and hopefully share some tidbits that I've picked up along the way too. So thank you all.
Thank you. Megan, would you mind going next?
Sure. My name's Meg, and first I feel like I just need to say that my heart is totally broken open. And also in the realm of what I saw on the screens as they were going by and destigmatizing trauma, I'll just name that I myself have gun violence in my own history, and both in my childhood and as recent as last year, I had an active shooter at my place of employment and I had to be in lockdown. And so I'm noticing as I'm entering into this conversation, my own activation in my body. Just feeling pretty sick to my stomach and shaky. And also trying to think of how I'm going to access my thoughts in this discussion. So I'm trying to ground myself. I have my feet on the floor. I am trying to take some deep breaths. I am so lucky that one of my best friends is also on the panel. So I keep noticing myself looking at her as a touchstone. And in the break, I ran downstairs and grabbed a pup of mine, and he's on my lap to help me ground too, just and bring comfort. So just want to say that that's kind of where I'm at as I'm coming into this conversation. But I suppose where my current interest, I have worked in lots of different environments with different populations of people who have experienced trauma. But I would say my more recent, in the last several years, interest is in our ecological crisis and the traumas we are facing with that. So that takes me back with my interest in that and in practicing psychotherapy with nature-based practices, just a curiosity in what I see as almost our original trauma, which is our removal from nature. Some of us have had more gradual removals, some of us have had more violent removals, and that reverberates to even into our present time. So my interest is in working with people backwards in a way to reconnect to that original trauma, because I know that what we are connected to, we protect. It has also helped me understand some of our paralysis and even participation in ecocide and how those traumas get us to our predicament today. And lastly, I would just say my interest is in helping people prepare for the predicament we're in and to look at adaptations for how we build resilience and what in the realities we are facing with our ecological crisis and societal degradation.
Thank you, Meg. And thank you for just sharing about how you're feeling and what you're kind of doing to take care of yourself in this time. I actually really appreciate that. Mike, would you go ahead and introduce yourself?
Sure. Hi, everybody. I'm Mike Greene. I'm a family medicine physician practicing in Omaha, Nebraska. My main gig, however, is I'm the program director for Creighton's Family Medicine Residency Program. So that's board certified physicians who want to train in family medicine. There's a 36-month training period that I run for Creighton. So I have 8 residents per year, so 24 residents that I teach the art and science of healing people. And so kind of some of the focus of the residency program is whole person care. I was taught the biopsychosocial model of taking care of people, but now it's kind of more the biopsychosocial, spiritual, political model. So taking care of people in all aspects of where they're at, because it seems important principles are humans are social animals, and humans don't occur in isolation. And when they do, it's very traumatic, as has been pointed out multiple times. And some of that severing of bonds is a great amount of trauma. And in fact, part of our job as healers is to use human relationships to reform some bonds that have been severed if possible. So I had in my early life a number of traumatic experiences that I spent most of my adult professional life trying to dissociate myself from and make sure that nobody knew about. And in fact, in this later part of my career, I find that that's actually probably some of my greatest strengths that I have in being able to explain concepts to other physicians and to form bonds with some of the patients that I see. So I use some of those experiences in a positive way. So.
Thank you for that. And then Abra.
Hi, my name is Abra Pointdexter. My pronouns are she, her. I'm hoping my dog is going to stay quiet in the background. We'll see how that goes. So a couple of things. One, I just want to acknowledge part of what Megan was sharing with us is a way to both self-regulate but also co-regulate. So honoring the fact that there's been such a profound loss of life today is the thing that in a mass form of mass shooting, and that can be incredibly activating, as well as just the daily loss of life, both in nature and personally and among people, that is happening and seems to be speeding up daily. I just want us to take a moment, if we can, just to acknowledge that. And if anybody finds themselves needing something to regulate in their own bodies, some of what Megan spoke to about just even putting your feet on the ground, just getting in touch with your own breath. And acknowledging that we are often, every day, assaulted with more and more knowledge of suffering. And that any response we have to this is a normal response. It's our body's brilliant, normal response to tremendously abnormal things. And thank you for just taking a moment. And that's something that we can do every day. I just want to name that we can do that every day, all day, anytime, just tuning into our own bodies and the ground beneath us as a way to regulate. In terms of my connection to this work and to thinking about trauma and why I'm on this panel, I am currently a psychotherapist in private practice in Omaha. I specialize in working with trauma and have been working in trauma for the last 25 years. I'm a trauma survivor myself, and my survivorship kind of changed the trajectory of my entire life. Where I was headed initially to where I am now are two vastly different directions. The film, The Wisdom of Trauma, speaks to, I think, the body's and mind's brilliant response to what happens with trauma, and how there is wisdom to be found in it. Dr. Michael Greene spoke to that a bit earlier too. I think you'll find that coming out in this panel and in the discussions this evening. My work has been initially in, like family and child welfare services, then in working with folks who are involved in sex work and sex trafficking, to sexual trauma survivors and gender-based violence. And I currently specialize in working with queer issues and LGBTQIA issues, and all forms of trauma, and how we recover and become well in an unwell situation that includes white supremacy, race-based trauma, and oppression issues. And what does it look like to reconnect with our most authentic selves? One of the things that the film brought up was that trauma disconnects us from our most authentic self. And I think our profession, as far as therapy, has had a history of pathologizing what's actually a really brilliant response to really difficult things. And my intention in my work has been to focus more on how people are beautiful and amazing, brilliant beings, and less on pathology. And I'll stop there.
Thank you so much, Abra, and for all of you for sharing. You just already kind of touched on this a little bit just a second ago, Abra, but I just want to ask the question, just what is trauma? It's kind of a word I think that gets thrown around a lot, but what is that? And this can be anyone that wants to answer this.
I'll throw my two cents out there. Not being a therapist, but not formally having studied this concept in medical school. This is not a topic that is on the normal docket of things that we will study in medical school. It's a significant amount of pathophysiology and normal physiology and adaptations. But as time has gone on, this is kind of what I would like to throw out there, that if an event happens, and if I use myself as an example, if I perceive that event, and then my body has a reaction to those thoughts, and then I engage in some behavior such that I want that body reaction to change, that's traumatic. So I mean, there are other events that I have reactions to that I want to keep going. That's not traumatic, obviously. But if I'm doing some behavior to make it change, I would say that that's trauma.
Yeah, Mike, I think that's a great place for us to start. And thinking about, there was a quote in the movie that said, it's not what happens to you, it's what happens inside you as a result of what happened to you. And so while kind of when that quote came up in the movie, I was thinking about this kind of like fundamental reorganization that happens inside of us when we are faced with an event, faced with a stressor, that we just do not have the internal or external resources to manage. And so that happens all the time. Like those are mini crises that we happen all day, every day. And sometimes we can reach out to friends or family, or we have some way to resource to get past that. But trauma happens when we do not have a way to resource in the moment to get past that. And when we are kind of have a fundamental reorganization of our stress response system and its kind of best attempt to get us through that moment. So that's kind of that little difference between crisis and trauma that I think sometimes we conflate. Is most people, we have crisis all day, every day. And most people, given the correct resources, will bounce back from that and will not have lasting impacts. Trauma is that lasting impact, that lasting kind of reorganization of our nervous system.
So in the film is titled The Wisdom of Trauma. And I just am wondering, what is that wisdom? Why do we say there's wisdom in trauma?
I guess I'll maybe start. I think how I think about that is that, again, our body has a really brilliant way to respond to things that are crises that do result in a longer term reaction. That initial reaction is often protective. Sometimes whatever that original event is too difficult to cope with and to manage on our own, and in the absence of other support. Sometimes we need to experience avoidance. We need to experience some way to manage that experience. I think in the film, what I really appreciated is the discussion about once we become aware that there's a connection between our trauma and those original events, we can show ourselves compassion and start to be curious about what happened to us, why it happened, what were the forces at play in it, and then what was our own particular reaction to it. And if that reaction happened to lend itself to addiction, to mental health issues, to other forms of things that we now want to change in our lives, it helps people to be understanding rather than judgmental. I think there's so much more out there that says judge those responses, when in actuality, kindness, compassion, and love in response to that, and understanding, it can reconnect us And then we can recognize, this is the thing that happened to me. This was my response to it. And while what happened to me, it doesn't define me. And I can determine what I want going forward for myself and glean the wisdom that comes from that. And understand that suffering is a part of all life. That, you know, when Charymane said earlier, most of us deal with crisis on a day-to-day basis all day long. I think that's really true. On a global level, on a community level, on an interpersonal level, recognizing that there's a common humanity in that, and that we have a built-in system to cope with it, and that there's wisdom in it, and that we can then learn how to respond differently in the future if we want to, can be really healing.
I'm going to kind of do a double answer. I mean, first, when I think what is trauma, I think look around. Trauma is war. Trauma is mass shootings. Trauma is our opioid crisis. Trauma is factory farming. Trauma is the cutting down of the Amazon, which are the lungs of our planet. So I think trauma is very easy to see in our current world. I also think that oftentimes when we talk about trauma, we talk about the presence of, but I think those of us who have experienced trauma and also sit and deeply listen to people who have been traumatized, it's actually the absence of is what carries that. And yes, it's accessing our resources, but I think what we need to look at is how are those even absent right now? You know, in the film, he talks about trauma as disconnection from the self, from our relationships, from animal kin, and from our earth. Those are a lot of layers and levels of disconnection that we are experiencing right now as a species. When I think about the wisdom of trauma, so part of being an ecotherapist is really helping and coming from a framework that is not one that is human-centric, one that does not, you know, supremacy in a lot of forms is coming down, and it needs to, but I would say human supremacy, as well as thought and knowledge supremacy, also need to be dismantled. It's not lost on me that one of our biggest current writers, thinkers, and teachers around trauma is Peter Levine, who actually learned about that through studying animals. And so I also invite people to recognize the wisdom in places that we can understand trauma that are not human. But also, I think while the body, I believe, is inherently wise, this might not be a popular answer, but I fear sometimes of what I call the Disneyfication of language, of we try to look for the silver lining in everything. And when you sit with people who have been traumatized, I don't think wisdom is necessarily inherent in trauma, but I do think it's an invitation into an initiation into what you are to make meaning, how you are to grieve that, what are you to understand about that, and how to not continue to pass that on, whether that's from our ancestral trauma or traumas that we have experienced in the here and now. And most likely for most of us, it's a combination. And how do we stop the perpetuation of that? But I would say that trauma can offer an initiation into some of that wisdom. But that's very hard work, and people who have done that will tell you it doesn't necessarily just come with a traumatic experience or event.
Yeah, Meg, I appreciate that. And I think there is, if I'm remembering correctly, there was a point in the movie where he talked about like thinking about like, what is the trauma trying to teach you? Like really leaning into asking like, what is it teaching me about my life? What does it teach me about my relationships? What does it teach me about myself? And that is hard work. I think it's much easier to just like learn a couple of coping skills and just try to manage our response as best we can and kind of truck on with life. And so I do think that like the true wisdom of like trying to be reflective about how deeply these situations impact our lives and have changed our lives, and that there's often no going back after them. What that actually means for us is hard and scary work.
Yeah, I was thinking that if a healed person is a person that's fully authentic to themselves and a person who is not disassociated from their relationships, their true self, the land, the earth, that healed person is not someone that I typically see in my practice. I see a lot of patients who I would say, and include myself in this, who are lost and trying to find their way back to that healing. And if you're lost, you need a guide, you need a roadmap. And one good place to start might be listening to your body and how your body speaks to you about trauma and what that means, and what events are triggering and what events are not triggering. And that's a good place to start looking for your guide to get you back to where you need to be.
Yeah, thank you for sharing all of those things. Meg, I really appreciate you mentioning grief in there. I think that's something that we don't consider, that going or healing from trauma can oftentimes include a lot of grief. And that's can be kind of scary and difficult to navigate sometimes. So thank you for mentioning that. So all of you have kind of already touched on this a little bit, but how then do we come back and reconnect with ourselves if we have experienced trauma? Or what does resilience look like, both for individuals and then as well for like the collective community? What are your thoughts about that? There's a lot of things involved in that question, so take what pieces you want and answer that.
Well, one aspect of that question, relationships. So some of my training, specifically the meaning of family medicine, is training to see the particular person in the context of their family and community, which is all relationships. So many people that I see, and it feels to me like more and more patients, when I am talking and checking in on them about what relationships are important to you, so many patients seem more and more isolated. And over time, that seems to me to be the case, that more and more patients are in isolation. And that's something that needs to be done with the healing surrounding that.
There's a wonderful book by Judith Herman called Trauma and Recovery, and which talks about just kind of overarching, regardless of what type of like intervention support, whether it's from a mental health professional or a friend or a family member, that like the core pieces of trauma is that it leaves you feeling helpless and it leaves you feeling isolated. And so any way that we can make you feel empowered and make you feeling connected will ultimately lead to some kind of growth or some kind of recovery. And so especially when I'm kind of talking with students who would love to kind of jump into like learning a bajillion different modalities and go to all of these trainings, this kind of just slowness of just like, how do we empower and how do we connect? Like Mike said, how do we reduce some of that isolation, some of that shame, some of that hiding, and get people back in authentic relationships? is kind of what I always have in my head when I'm working with clients and when I'm teaching students, those overarching principles, connection and empowerment.
You know, I think about this, we're talking about it from a human perspective in some ways. I think Meg's asking us to kind of expand beyond that. And I think each person that I work with comes with their own unique way of needing to reconnect. You know, like some people need to reconnect in relationship to another human. Some people it's reconnecting through their body. Some people it's reconnecting through nature. It's an animal, you know, it's like a first healing relationship with an animal. And that's the first thing I think about is that the sense of knowing that there is something else that we belong to beyond ourselves, and that also whatever can help us learn that we also belong to ourselves. There's a book I sent in as one of the resources. It's Resmaa Menakem's book called My Grandmother's Hands, and it is a book about expanding Peter Levine's work that Megan spoke to earlier, about the somatics of trauma. And he talks about the 6 intelligences and how we have been separated from ourselves in response to white body supremacy and in response to our supremacy over nature in general. And the intelligences he talks about as practicing are learning to just get in tune with our own body's response to the vibration of a situation or the vibe of a situation, to the images that come to us, to the meaning that we derive from something, to our own behaviors and our responses that our body's telling us to do in response, to our affect or our feelings about something, and to where sensations show up in our body. And I find sometimes with people I work with, a relationship with another human feels really unsafe. Sometimes the first experience of any form of trust is starting to trust their own body, or trust an animal, or trust just sitting in nature and quiet, or listening to music, like something that connects them to the larger picture of humanity and to their own bodies. And I think several people have mentioned that I think we want the idea that there's a quick fix to this, but I think the truth is that grief is a part of life. And I think we've done harm by maybe not teaching that from the very beginning. Or I don't know how to say it, like that suffering is a part of things, like, and teaching ourselves and our people and those around us that we will need to have some capacity to manage the truth of what's around us and within us all of the time. I'm not sure exactly how to do that. I just know that we sometimes like to escape into fantasy as if suffering isn't a part of life.
Yeah. Ooh, such good answers. I'm enjoying listening to everybody. Yeah, one of the things I just want to name before I go into resilience is, you know, people have been talking about grief. And I think oftentimes we think of grief as a feeling, but I think what Abra is naming, even in just talking about starting at a young age, is that grief is actually a skill. It's a skill and it's a practice, and you become a practitioner of grief. You don't ever become a master. Grief itself is the master. But I love this question of resilience. And I think at the beginning, I mentioned my own interest in resilience. And I think my interest lies because I'm curious about reimagining what that's going to look like. Because for me, as I look and face some of the realities of the ecological crisis and what that means, so much of what we have talked about historically in trauma is safety, which oftentimes also gets translated to what we can control for. And unfortunately, we are in times Some people call it, we have left ordinary times. I know I'm a big alchemy fan, so some people call it that we're in the Negredo, the long dark. But we are in a time of descent. And I think what Abra was talking to and speaking to too is that historically we are an ascension culture. And that's not where we're at. And so part of my interest in resilience is because I'm interested in what that is now going to look like, because we are in a time that is unknown and uncertain. And I think our old definitions of resiliency may not serve us in this new time. And so for me, one of the things, or several of the things I'm looking at with resiliency is, how do I, and how with the people, the clients I work with, resiliency might be, how do we learn to feel our way through the dark? How do we develop our senses in that? How do we grow our capacity to sit in the unknown? But also, I think resiliency for me looks pretty practical too, which is one of the reasons I'm drawn to nature therapy and horticulture therapy. How do I teach people how to grow their own food? How do we get connected really as community, as neighbors? Do you know the names of your neighbors? Just some of these, do you know how to pump water? Do you know how to use a compass? That's my backpacking self coming out. But I mean, some of these things I am introducing in and working with in my practice as well, because we will need those too. And so I love listening to what people think about resiliency, because I don't know what that's going to look like. But I think it's important just to name that might look different. I also think resiliency is going to be better at improvisational skills and how to improvise, which is also where nature-based therapy has been helpful, because out on the trail, I can't control for everything. And it's an opportunity in vivo to be able to work through that together, to regulate together, as we cannot control for everything that's happening. And unfortunately, historically, therapy, our practices are about trying to control for everything, in our offices, but that's just not the reality of the world that we're living in. So I think it also offers an opportunity to break open some of those boxes we've been stuck in, and think creatively new ways of how we're going to face this together. One of the things I tell my clients, which is a Gabor Mate quote, is, the old Marine saying is, the only way out is through. But he adds, the only way through is together. So.
Thank you all. I love hearing all of your answers about this. And I appreciate kind of the, maybe the ambiguity that is resilience, because that is definitely, like, that's another term I think we kind of throw around and maybe don't fully understand what that looks like. And maybe we don't understand because it looks like a lot of different things. I don't know, Dominic, do we have time for one more question, or do we need to do breakouts? I'm gonna let you.
We could do one more if you have one that you're really wanting to make sure that we get.
Yeah, I would love to hear from all of you. Just, I think we've also kind of touched on this already, but just why is trauma and resilience a topic that we need to talk about? Especially, like, it makes people uncomfortable sometimes. They don't want to talk about it, even if they have experienced it, or if they don't think they've experienced it, they extra maybe don't want to talk about it. Why, as individuals and as a society, is this something that we need to be kind of more aware of, just as we move throughout our lives and in our own personal lives? That's also a big question.
The first two things that came to my mind is why it's important for society to know about trauma. One of my most important guiding principles is first, do no harm. And it's important if I'm going to act and live my life in a way that I am not harming people around me, to know what is harmful, to know what is trauma inducing, and to avoid that. And the other thing that I was thinking about was just how omnipresent it is in people that I encounter. If I'm discussing diabetes and we're getting at the root causes, it's trauma. If we're discussing high blood pressure, often there's trauma. If we're discussing any, just pick anything that honestly that I deal with, that so much of it comes back to trauma. So it seems a very timely topic.
You know, Megan mentioned earlier that we are an ascension culture. And I think when I think about that, I think about that in particular, in terms of white supremacy, we have been an ascension culture. I think, disconnected from the harm that we have perpetrated over the last 400 years as a culture. And I think that some of what we are experiencing is that in many ways we need to hold that harm now. Like, I think that acknowledging it, like that harm has extended beyond like the genocide that's been perpetrated on peoples, Native American folks and Black folks in this culture, and into the earth itself. Like, and I think we're being asked to face that on a completely different level. And that until we do, I think the things that we're talking about, like when Mike spoke to like the physical ills, I think some of those physical ills are how we've dissociated and disconnected from ourselves, each other, the land, and that we can't continue to live in the same way anymore. That all of that is trauma, that we are being asked, I guess, just by virtue of how ill we are, to shift our relationships with each other and everything around us. I don't think we can escape it. I think that the kinds of violence that are happening on a daily basis will continue to escalate until we change ourselves.
Yeah.
Just piggyback really fast on to Abra, what Abra was saying, just because I think the problem isn't even in the question, which highlights this myth of separation, that there's some luxury, like, should I talk about this? Do I want to recognize it? I think that's what's crumbling, whether it's the myth of separation, which I think is back to the original trauma of being disconnected from earth and earth practices, but also the separation from our history and what has taken place in this country, to people, to animals, again, factory farming. Like, to think that it's not touching you in some way is to uphold a myth that's not true. And so even the question in and of itself is like, whether you choose to acknowledge it or not does not mean that you will not be touched by it. And the more, even if you have been in a highly privileged state, the more polycrisis we face, it will touch your life, and it already has. And this interconnection that we want to disconnect from, that if it happens over there, it doesn't affect me. That's that myth of separation. That is a myth. And that's part of what we're needing right now, is a new story.
Yeah, I think it's important that we talk about it. I think it's important that we talk about it in a way that it doesn't become so watered down and so routine that we're not talking about it in reflective and deep ways. I think we have been talking about trauma since the beginning of the psychology profession. I think you can kind of trace this back to the work of Freud and Charcot and far before that. And so but only till recently has it moved from being a specialty into something that generalist practitioners need to understand. And so even the field of psychology and counseling have in the past 15 years have moved to a spot where it's like, oh, this isn't just like a specialty. This is something everybody needs to know about. And I think now we're getting to a spot where like, this is not something that's just talked about within a 50-minute session that you have with a therapist. This is something that everybody needs to be talking about and recognizing. And so the only way that we're going to create trauma-informed systems, not just medical systems, not just therapy systems, not just formal systems, but a trauma-informed world that is not just accommodating, but compassionate toward individuals' reactions to what they've experienced throughout their life, is if we continue to talk about it in reflective and meaningful ways.
Thank you. This is a topic. Each one of those questions can have its own table talk. So thank you all for answering those questions and sharing your insights with us. Dominic?
Yeah, absolutely. So thank you again for that wonderful conversation. We are now to that point where we will be sending you out into, I think it's 4 breakout rooms, with each one with a facilitator in it, discussing with questions on this. As we go into those spaces, I do ask that we agree to some breakout room agreements. Our agreements are 1 speaker, 1 mic. So at proper turn taking, as somebody is talking, please actively and openly listen to them and not talk over. We ask that any stories, any personal stories that are shared in these breakout rooms stay there. The lessons that we might learn from those stories leave. So and that's what we call our biggest twist: stories stay, lessons leave. Making space and taking space. If you're somebody who does find themselves to talk a lot, maybe make some space for others who can take that space and share their ideas and their experience as well. Keeping that open mind, and then being respectful of each other as well. So as we go into these breakout rooms, one other thing I would like to again reiterate is, please be mindful of how you are feeling in these spaces. You are not required to speak if you do not feel comfortable or do not want to talk. You can just sit in this space and listen. Again, you do not have to keep your camera on, or you can be on mute the entire time, both camera and audio. The breakout rooms are not recorded. And then one last thing that Colin just reminded me: when you do come back to the main room, please ask or have somebody elected, if you will, as a spokesperson that can do those share outs to the larger group. And that can either be your facilitator or somebody that's not the facilitator in your group. So we will go into these breakout rooms for about 15 minutes. I know that's not a lot of time for this conversation, but the facilitators will actively move you through that. So we will see you in about 15 minutes. Welcome back, everyone. I hope you all had some fruitful conversations. Again, I know that time is never long enough, but we are on a time crunch, if you will, to honor everyone's time tonight. So at this point, we would like to do our share out. So if I could have a person from each of the rooms share out 1 or 2 themes that came out of your conversations, that would be great. So we'll start with the group that was facilitated by you first.
Kara's going to report. Thank you.
Awesome.
Okay, hi. I think we talked a lot about all of the wisdom that the panelists had to share, and especially just resonating with really a lot of, Meg, what you were sharing about just human supremacy and knowledge and thought supremacy, and how that was just so, as much as we maybe know that, it's not something that we reflect on very often. And, you know, we talked a lot about how important kind of accessing our body as our guide, which was what Mike had talked about. I mean, every person said something that I wrote down that we shared in the room, and it was very helpful. But I think at the end, what I really appreciated about our group, and Katie was the one who said this, which is having this conversation with this group of people at large, and then in our small groups, felt healing, felt connected. So maybe that's our biggest takeaway.
That's really wonderful.
Yeah.
Thank you. The next group would be, would somebody like to share out from the group that was facilitated by Kit?
I could do it if no one else is inclined. We had a nice conversation that touched on several of the things the panelists offered, largely focused on the power of connection, and connection being an essential part of the path to healing. There was also some curiosity in our group to explore the conversation around psychedelics, and as presented in the film, and how that could be connected to healing and to connection. And then there were a variety of ways that we were integrating, various members in the breakout room were integrating the conversation around connection to the environment and disconnection to the environment as part of trauma, and how we help healing, and how we guide conversations, specifically with professionals in the group when they're working with clients. So thank you.
Thank you. Who would like to share out from our group that was facilitated by Holly?
I'm sharing for our group.
All right.
Yeah. So we talked a lot about how trauma is all around us, and there's a lot of different ideas around healing, and that's okay, and how that's really individualized depending on the needs of the person. But then we also talked about how things like this and connecting and talking as a group are very healing and processing as well. There were some aha moments around the physical impact of trauma, and not always associating heart disease or diabetes and so on with past trauma in our lives or our ancestors' lives. So that was a good conversation. And a few people had actually read The Body Keeps the Score. And my takeaway from them was that it was worth the read. So that sounds like a good resource too.
Thank you very much.
Mm-hmm.
And then our final group share would be from the group that was facilitated by Rachel, who would like to share out in just a couple themes of your conversation.
I will share out for our group. The words that I heard were enrichment. In recent events, we've been seeing a lot of disconnect happening within our circumstances, where we find that disconnect growing our community through food, human connection, and nourishing our bodies with the foods that we grow. Essentially building a community from the ground up. When asked what we could do to better support our family, our general theme and slogan was, "We're doing it." So Yeah. Yeah. Human connection through building our community from the ground up, and just agreeing that this conversation of connection is very healing.
Thank you, Rachel. So we are running out of time, but I would like to ask each of our panelists, if you would, and I'm sorry I did not prep you about this earlier, so please take your time to think through this, but what would be like a takeaway or an action item, if you will, for folks around this conversation around mental health, trauma, and resilience? So, and it can either be a takeaway or a way for folks to grow more in this understanding of trauma and resilience, however you want to frame it or think or leave us with.
As much as we have the conversations, it helps to destigmatize the everything that we're talking about. Destigmatizing clears the space for healing to happen. So a takeaway is having more conversations. So many people feel like they're the only one, so to speak, and I think that is rarely the case.
I think that there's an importance in pacing yourselves in these conversations. I think about this around trauma conversations. I think about it around conversations around racial justice. I think about it around conversations that really require you to be actively engaged, reflective, give something of yourself, and you often come away from them feeling quite depleted. I think sometimes we can feel like we need to always be engaging with this, that it's our responsibility to always be engaging with this. And I think sometimes that we're missing the mark on how tiring it can be. So there's no harm in finding pockets of joy when you're not reading about trauma, finding pockets of joy when you're not doing this work, so that you can have the energy, the time, the capacity to jump back in with your full self, which I hope you do. So just listening to your own body, listening to what you need, and not being afraid to take some rest, find some joy, and then jump back in when you're restored and ready.
I'll piggyback on Charymane because I have something similar, which is one of the things I mentioned in the small breakout groups is sometimes I recognize as mental health professionals the disconnect between what we speak and what we do. And we keep talking about connection, and yet therapy itself has become more individualized, privatized, and medicalized. And so I want to remind people, I often say that I think, especially as we head into this next into the long dark, that we need more city of joy than we do medicalization. And for those of you who aren't familiar with the City of Joy, it's a program in the Congo that was created to address war violence, especially towards gender violence and sexual violence. And at the City of Joy, yes, there's therapy, but there's dancing and there's singing and there's cooking. And I just want to remind you that even if you're not a mental health provider, we've siloed trauma almost as if it can only be done in these spaces. And we need everyone to be involved. I remember watching the news and seeing the Ukrainian children singing together, and I thought, yes, that's exactly what they need right now is that singing. So just remember that you don't have to be a trauma specialist in order for this to happen, to help people, because for me, at least, trauma is about helping people come back to life. And there's a lot of ways to do that. And the last thing I want to say, I wouldn't be a good ecotherapist if I didn't say this, is that I just want people to keep in mind that when we talk about animal kin and nature-based therapies that we are an extraction culture, and we tend to think of things as we're going to go to the forest for it to heal us. I need this support animal to heal me. And so much of ecotherapy and what I help remind my clients is that reciprocal relationship. It's a real kind of mind-blowing experience to ask the forest to enter in, or to not just pick a flower because you want it. And so part of ecotherapy is also, how do we heal the forest too? How do we heal animals as well? So I would just want to keep in mind that reciprocity can also be resilience in trauma recovery.
I think, I guess the last thing I would think about is, like, I loved Charmane's mention of rest, and also just whatever naturally calls to you. Like, there's no one way to address this, to think about it. If there was one thing in this discussion that stood out to you and you can carry that forward for yourself in like a reflection, and or if you can carry that forward to one other person in your life that you care about, just that alone even could be a reconnection and continuation of this discussion. And it can be as simple as that, that this conversation can continue and kind of web out from here. And some of the things that stood out to you as important, there's a reason intuitively that you're being called to that. And so whatever that is for you, to take that and carry it forward. Even if it's just that you get more rest. And if it's not that, if it's having a conversation with somebody in your family, or a friend or a coworker or someone, as simple as that, or tending to your body differently.
Awesome. Thank you all very much for being here with us tonight, being on this panel, and thank you for everyone and just being here in attendance and adding to the conversation as well. I am going to share in the chat that link for our evaluation form. I do ask that if you would like to, or feel like you want to, please fill that out and provide us some feedback on how we can grow and constantly get better at these events. Otherwise, have a great rest of your night. Please take care of yourself, and we will see you next time. Our next table talk is on June 7th, and that is a queer table talk around mental health within the queer community. So thank you very much for being here, and we'll see you next time.